Good morning, Peter Goertz. I'm a psychiatrist. Risks versus benefits of psychiatric medications. As a doctor or a psychiatrist, you're going to have some struggles. And we want to abide by the Hippocratic Oath, first do no harm. And that can be tricky to decide what the balance is between potential harm and potential good you can do for the patient. I saw a patient in overwhelming distress, in a crisis, and the main option that I felt was going to be useful was medication. Were there potential other options? Possibly, but not that I could think of. So as a doctor, when you prescribe medication, you want to always weigh the benefits and risks. Are the potential benefits worth the potential risks? An example is Seroquel, which can have serious adverse effects, including tardive dyskinesia, so movements that may or may not go away, like twitching. The patient I'm referring to was not sleeping much. 1 hour the previous night, was very anxious. She'd been off psychiatric medications for months until recently. There was a history of bipolar disorder, psychiatric hospitalizations, psychosis, suicidal statements. The family, I spoke with a family member on the telephone separately. The family was concerned, but not to the point where they felt that psychiatric hospitalization was warranted at that point. And so I'm sitting with the patient, and it looks like the patient's on her way to a possible manic and/or psychotic episode. And I'm thinking psychotropic medication. We need to prescribe something so she sleeps, so she's less anxious, so her mood is stable, hopefully. Is there another option? Again, possibly, but within our system at that time, I did not see any. So I'm thinking of Seroquel. And Seroquel can cause weight gain, high blood sugar, high cholesterol, can cause tardive dyskinesia. So I spoke about all that with the patient, and if I remember correctly, also with the family member. And ultimately, the patient was actually quite relieved, I think, to think of the possibility that a medication could help her relieve her distress. And I decided to recommend the Seroquel, starting at a relatively low dose and gradually titrating possibly. And this was an emergency room patient, so not a patient I was going to see again. So it was a little tricky to know what to do about the dose, but I decided to recommend a low dose and then gradually titrate. And hopefully she did well. Hopefully she slept, and that I think would already have made a big difference. Are there other options aside from medication in our current system? Again, not that I can think of for that patient. In the past, there was something called Soteria House that was initiated by a psychiatrist named Dr. Loren Mosher. And what he did was he had schizophrenic patients in acute episodes come and stay in a house with staff that was not medically trained, as far as I recall. And the patients received possibly low doses of medications, sometimes no medications at all, and reportedly did quite well. So potentially, if we change our system, there may be options to address situations like this. So acute psychiatric situations without medicine or with minimal medicine. But again, in this situation, the risk-benefit balance to me seemed to indicate that Seroquel was the way to go, or at least a good option for that patient. And again, it's a struggle as a doctor. You don't want to do harm. You want to do as much good as possible, but any medicine has potential side effects. Thank you.